Good, mo Good morning, everyone. So, our presentation, what I'm going to teach today is cast metal restoration. So, in cast metal restoration, I'll tell you few things which you should know before the lecture begins. First is inlay. Inlay is defined as a fixed intracoronal restoration, a dental restoration made outside of the tooth to correspond to the form of prepared cavity, which is then luted in the tooth. It is given by the Rosenstiel. Class 2 inlay involves occlusal surface of proximal surfaces of a posterior tooth and may cap one or more, but not all of the cusp. Okay. And the another one is class 2 onlay. It involves the proximal surfaces of posterior tooth and caps all of the cusp. So let's come to the indications. Indication of cast metal restoration. So what exactly are cast metal restorations? It is generally given through the alternative to amalgam or a composite restoration when high strength is needed or superior, contacts or contour is needed, especially in class 2. So whenever a case like class 2 comes, where a proper, the contact should be good for proper oral hygiene maintenance, in such cases, we go for uh, cast metal restoration. Extensive proximal caries, which is not managed by composite restorations, in such cases, we go for cast metal restorations. When proximal margins are extending subgingivially, in such conditions also, cast metal restorations are highly indicated. When extension of MD, mesial distal dimension of tooth is necessary to form a contact with an adjacent tooth. In such conditions, cast metal restorations are indicated. Presence of other gold casting in the mouth. Okay. So when the cavity width does not exceed 1/3 of the intracuspal, if it exceeds 1/3 of the intracuspal, you have to go for cusp capping. And in patients with good oral hygiene and low caries index. So any cast metal restoration, especially inlay, it's a pure intracoronal restoration and can be used only when a cavity width does not exceed 1/3. You have to keep in mind it should be strong, self-retentive cusp remains should be there. Cusp should be strong. If the cusp are not strong, you cannot go for cast metal restoration, especially inlay. You have to go for full coverage restorations. Then when indicated teeth have minimal or no occlusal facets, it means the occlusal forces are within the limit, not heavy. And the tooth is not to be an abutment for removal or partial or a fixed prosthesis. Occlusion or occluding surfaces are not to be challenged by restorative procedures. Uh, Now we should know the contraindications, means the cases or the areas where you cast metal restorations are highly contraindicated. First is high caries rate. In such cases, you should not go for cast metal restoration. Young patients, why? Because the cavity preparation is quite deep, and young patients have high pulp on, so the cast metal restorations are not indicated. Aesthetic purpose, obviously, small restorations you should go for GIC or composites rather than going for cast metal restoration, which is very technique sensitive and takes more time for fabrication. In grossly decayed teeth with weak cusp, obviously you need the underlying cusp to be strong to hold the restoration. If you're using abutment or a fixed, presence of dissimilar metallic restoration, you have to be very careful for galvanic shock. If gold is present, you should always avoid cast metal restoration and cost. Advantages are high strength, unreactive in oral environment because of the metal presence, low wear, obviously, great control over contacts and control because it's an indirect, form of restoration. It's like you make it outside the oral cavity, cast it, and then you lute and cement inside the tooth prepared, and it's very biocompatible. Disadvantages are higher appointments, obviously, one appointment for your tooth preparation and impression taking. Second is for, again, the patient has to come for the cementation. Temporary restoration is required, which is not required when you're doing a direct restoration. Cost, technique sensitive, and splitting forces. Yes. The wedging forces are too much high when you're going to give a cast metal restoration. Armamentarium, when you go for cast metal restoration, tapered, round, or cylindrical carbide burrs are used, finishing stones, mirrors, mouse mirror, obviously, explorer, periodontal probe, chisel, hatchet. GMTs are needed for marginal, giving proper form. Excavators, high and low speed handpiece, and articulating films. Can you see here? These are the carbide burrs. There's a 0.8 millimeter diameter. 169L stands for long shank. 271 burr. These an 8862 burr. This burr is also known as flame shaped burr, and this is used for giving bevels, which plays a very important role when it comes to cast metal restorations. Design 16 flutes finishing burrs angle. Finishing burrs are like this. Arkansas stone, sandpaper disc are used. You can see here. Okay. Now let's just read about the basic concept of inlay cast restoration. See, cast restoration can be inlay, onlay, multiple. I'll just give you the brief of inlay cast restoration, how exactly it is. So there are three things that is most commonly. First, preparation part, a pico-occlusal taper, circumferential tie. The circumferential tie can be occlusal and gingival bevels, facial or lingual bevels, just primary and secondary. Then preparation path is your single insertion path, or all reduction orientation towards one path. So what exactly it means is, see, see here, this is your prepared cavity and this is your inlay. So your inlay your placement of the restoration and the removal should be in one path. If it has multiple paths, the chances are there the retention of the restoration or cementation of that inlay prosthesis won't be good. So the line of draw, it means how it is removed, and path of removal and reinsertion should be perpendicular to the plane across cusp tips or parallel to long axis of the tooth crown. Here, can you see? It should be parallel. Okay, long axis. Features help in retention of restoration. I've already explained. Inlay taper. What do you mean by taper? Taper is a pico-occlusally taper. Okay, so cavity wall must diverge from floor to ground. Diverge. Can you understand here? Can you see this is diverging? As we have read in amalgam cavities. Amalgam cavities are mostly what? They are convergent. Why? Because the convergence give it a proper retention. Here the divergence is there. If it's convergent, how will you place the inlay? What do you call it? Yeah, the casting won't be placed inside because when it's convergent, so you make it little divergent. And the taper should not be more than 2 to 6 degrees. Why? Because if you give more taper, the your restoration will start rocking and the retention will go. Okay, so if you have more length, you can increase the taper, but if you have a shallow depth, the taper should not be there. Zero taper should be given. So here, to permit unobstructed removal and placement of wax pattern in casting, developed by preparing occlusal walls so that they form obtuse angle with the pulper flow. So here 2 to 5 degrees, even in some books it's given 2 to 6 degrees also. So it can be a very important neat question. Next, taper can be increased or decreased depending upon the following. These things you have to remember. First thing, length of the preparation wall. It means if the length is more, you can increase the taper. If the length is short, it means depth is there. Depth is not there, shallow cavity. So you have to not increase the taper. Dimension and details of surface involvement, interior angle, internal anatomy in the preparation. If anatomy is so good that it already have a proper retention, so you can increase the taper. But if retention are not there, then you have to think about it and then need for retention. See here, can you see here? This is little bit taper is there equal. Taper can be done solely at the expense of one side only if opposing side is absolutely parallel to the insertion path. In some conditions, one wall you can make it parallel, the other you can give for uh, taper. Under no circumstances, taper should be unequal. One should be either parallel or taper, or both should have the equal taper, as this makes more than one insertion path and then result in micro movement or loss of retention. The path of insertion and removal of the casting in the axis of the taper. Can you see here? It's given like this. This is intracoronal taper, this is extracoronal taper. This is especially when you give the crowns. Class 1 class 2 axis of taper is generally parallel to the long axis of the tooth. In class 5, it is perpendicular to the long axis. Next, we read about now we'll talk about circumferential tie. The circumferential tie, the peripheral margin anatomy of the preparation is called as circumferential tie. So what Noy has given, I'll just explain you brief. You people can read from the PPTs later, that any enamel which is unsupported should be removed. So especially at the, the edges, why we give flare or bevels, they are given so that we remove the unsupported enamel. Why you're supposed to remove the unsupported enamel is the strength of unsupported enamel is zero. So when you place your casting there or your restoration, the chances of fracture increases. That's why you're supposed to remove those unsupported. What do you mean by exactly unsupported enamel? Is the enamel which doesn't have an underlying dentine to support it. Okay. Bevels, most important. What do you mean by bevel? It is a plain cutting of a cavity wall or a floor directed away from the cavity preparation. Why should we give bevel? Easy to burnish, better margin adaptability, prevention of micro leakage. You have to remember there are 6 types of bevels. Can you see here? Partial bevel, short bevel. Partial bevel is enamel not exceeding 2/3. Short enamel is full enamel. Long bevel is full enamel as well as one half of the dentine. Then comes the full bevel. Full bevel is here where entire dentine as well as enamel is involved. Counter bevel. This is mostly given when you are going for a cusp capping. So whenever you are going to do a cusp capping, to protect the cusp, you remove some part of the cusp. This is called counter bevel. And hollow ground is generally given for space for cast material bulk. So whenever you give a restoration which needs a bulk, here you give the hollow ground. What is functional bevel? Most important requirement of ideal cavity walls, produces cavus surface angle 135 to 145 degrees, bulkiest and strongest configuration for any tooth margin. Produce acute angle metal margin 35 to 45 degrees. Marginal bevel reduces space between cast and tooth substance. Here, can you see how you are supposed to give the bevel? Rather, it provides major retention for cast restoration by providing direct retentive functional frictional components between the casting and the tooth. Hollow ground, occlusion, and counter bevel are used for resistance form on the tooth restoration complex by covering the cusp. Then gingival bevels that bring gingival margin to the cleansable or protectable area. Generally, amalgam restorations, we give the gingival bevel. So here, another thing you have to know is butt, lap, and sliding. Butt, here approximately 90-degree your tooth and the margin. 35-degree metal margin. Here can see lap, and sliding is this approximately 25 degrees metal margin. So whenever you have a casting and a tooth, this is the 3 types of joint you have to remember. Next comes the flare. Flare are used as flat or concave peripheral portions or facial and lingual proximal wall in intracoronal cavity preparation for casting. So I told you, we give bevels and flares for the retention. Here, there are 2 types of primary flare. Primary flare we always give. Secondary we give whenever it's required. Here, can you see the primary flare? Primary flare is a conventional or basic part of circumferential tie, similar to long bevel. What was the long bevel? See, how many types of bevel was there? First was, can you see here? Short bevel, partial, short, and long bevel. So long bevel was the enamel, dentine, and half of the dentine is involved. Okay. So next is primary flare. It is same as, where were we? Flare, right? Similar to long bevels, specific angulation 45 to inner dentinal wall proper. Then again, same as bevel, bring facial and lingual margins for the cleansable area, finishable area. Any facial lingual proximal wall of intracoronal restoration, we give flare. Secondary, it's almost flat, plain, superimposed peripherally to the primary flare. Sometimes prepared in a hollow ground form to accumulate material. Prepared solely in the enamel, but sometimes may involve dentine. Okay, unlike primary flare, secondary flare may have different angulations involvement. What was the angulation for primary flare? It was 45 degrees. Okay, additional retention forms, we give retention grooves here. So can you see here? Then internal box is made. Gingival slots, capping, cusp capping, luting cements, skirts are used for extra retention. Here, collars. Can you see here? This with burr, you make a collar on the cusp for a extra retention. Reverse bevel. Here, this is also called as Minnesota bevel. This is one most important neat, Viva question. Here bevel, this is reverse bevel. Okay. Variation in proximal design. These names you have to remember: box preparation, slice, auxiliary slice, and modified flare. Okay. Uh, Now, as you people have already known, okay, what are the burrs used? I have already explained, showed you the picture. 271, 8862 burr was a flame shape burr for primary flares and bevels, and number 169L burr, this L stands for long shank. Okay, next. Already of all of you must have in fundamentals, you must have read about the outline form, resistance and retention form, carries convenience form, finishing, and all this part. So it's the same. All you have to follow all the fundamentals, and you have to make it here. See here, gingival exival, Minnesota ditch, another one, enhance the retention. So convenience form, it's there. Now tooth preparation, it's the same initial form burr you have used. You can skip. It's the same how you do the class 2 restorations. Retention forms, if needed, you can give. Uh, Modifications in inlay tooth preparations that you can read about here. Mesio-occlusal distal preparation taper. See here. In case of severely weakened marginal ridge, the proximal surface is included in the preparation. Modification secondary flare is omitted so that if you give more secondary, there are chances that it is seen on the buccal surface, so it's avoided. Then it's not that important. Cusp capping, cusp capping. This is very important. Half the distance cusp capping is considered. Two-third distance capping is mandatory. See here. Half the distance, it's you can think about doing cusp capping. If it's more than two-third, it's definitely you should go for cusp capping. So I just want to, conclude. See, what all thing is very important for you people is uh, cast metal restorations, mostly inlay. So those three things, occlusal, pico-occlusal taper, okay, and then your circumferential tie in which all the bravels and flares it's given, that you should remember. And the cavity preparation is exactly almost same like how you do the class 2 cavity preparation fundamentals. So in this, the amalgam restoration, in this your occlusal taper is generally divergent. These things are there. And then cast metal restorations inlay one third or intercuspal distance. So whenever it's too much intercuspal distance. So I would like to conclude. Cast restoration is a challenge to dental profession for its success, as it contains many steps, obviously. So you must have to follow these steps very precisely for success of cast restoration. So I hope all of you must have understood. So if you have any doubt, you people can mail me. My email ID is drlakshmipande024@gmail.com. Thank you.